Hello, good evening. Welcome to Facebook Live with us on Narikotha. And today I have a very young and dynamic personality in my clinic. Her name is Dr. Sudarshana Gupta, and she has done PhD from Maryland, USA in clinical counseling psychology. And today she's going to talk to us about the importance of psychology. And let's hear from her. Sudarshana, we are just over with the festive season, and Shubha Vijaya to you.
Shubha Vijaya.
And this is a cube of dark chocolate. And why I'm giving you this dark chocolate is because, we've been hearing that if you're depressed, I have a friend who, if I tell her that, Molly, I'm feeling sad, then she will say, immediately have 2 cubes of dark chocolate. And she actually swears by it that if you have 2 cubes of dark chocolate, your blues are going to go away. So, is it true? Does dark chocolate help?
That's such an interesting question. And I think especially today is Halloween. And usually in the US, people are trick-or-treating and this time eating chocolate. So I think dark chocolate is very interesting because it has a few compounds which there's some studies to say that, it makes you feel more relaxed. But I think, as a small band-aid in the moment, it's a good little perk. But when, someone has clinical depression or a serious mental health problem, then I would suggest a little bit more than just chocolate.
Okay. So when chocolate doesn't help,
yes,
we really need the help of psychological counseling. I think to start with, the issue of mental health is still very ignored and ill understood in our society. And to start with, I think please explain to us, what do you mean by psychological counseling?
Sure. I think that's such a good place to begin because, like you mentioned, in India, the 3 big problems with mental health are that there's very poor awareness of what mental health symptoms are. কি হচ্ছে লোকজনের অনেক সময় কেউ বুঝতে পারে না যে someone is depressed or anxious. The second thing is there's a lot of stigma. So even if someone knows that I should go to a counselor, আমি শুনেছি একটা ভালো counselor আছে, তাহলেও লোকেরা যেতে চায় না because there's stigma, লোকেরা কি বলবে, পাগল ভাববে. So to answer your question,
yes, I think I would like to interrupt at this point. এই পাগল জিনিসটা is so widespread in our language, in our expression, and I think even in our thoughts. When the minute you say that you need counseling, immediately they just become judgmental. They jump on to conclusion. যে তাহলে কি আমি পাগল হয়ে গেছি, তাহলে কি আমাকে কি পাগলের ডাক্তারকে দেখাতে হবে? Something like that. I mean, this has to change.
Exactly.
And this talk show, as I would like to call it, is something where it's a very small step. Whoever is watching it will understand that, we are trying to create a public awareness about this importance of psychological counseling.
This is how we start because like you were saying, পাগলের ডাক্তারের কাছে যাবো, এটা আমিও অনেকবার শুনেছি. So I think Facebook Live and spreading the awareness is so important because counseling isn't just for people who have a serious mental health issue. If you have a serious depression or anxiety issue or something else, then counseling will definitely help you. But in addition to that, anyone who's going through a stressful life situation can really learn a lot of skills from counseling. They can benefit from having someone who's non-judgmental talk to them.
True.
So,
True.
yeah.
Society is changing. Definitely it's changing. But, more changes are required. Now, regarding this, like we were saying that there's so lack of public awareness in this. Just like the lack of public awareness, there is also a lot of myths which surround this issue of counseling. And I will still say that, running a clinic in South Kolkata, which is quite a hoity-toity area of Kolkata, and still, counseling, the minute we say counseling, people have this tendency to shun away from it and to withdraw. And there are a lot of myths. So I think we'll try to address the myths one by one. And those who are joining me, I will request all of you to send your questions to us and what you think. If you think that this could be a myth, please write to us and we will try to solve your queries.
Yeah.
So I think the first myth that surrounds is that आगे तो counseling एतो लागतो ना, and there were joint families, and families and friends are probably the best counselor. So, but I think it's a myth. So what do you think? What do you think about this?
That is a myth. I mean, of course, peer support and family support is very important, and human beings all need friends and family to understand them. But a counselor is specifically trained to help you learn the best way to get out of your problem. The counselor is also not directly involved in your life. Your friends and family, even if they mean well, they have a hard time objectively seeing your situation because they also have a part to play in your life.
And they know the past,
yes.
And in a way they can predict the future also to some extent, and they cannot be neutral.
Yeah.
That's the thing.
And often, people have a preconceived idea of like so-and-so is like this. So going to a counselor means you get a blank slate, someone who is trained and non-judgmental and who will give you an objective view on what's happening. Because the counselor isn't involved in your life in any way.
আমার মা সবসময় একটা কথা খুব বলতেন যে কোনো খেলা যারা খেলছে তারা যতটা না খেলাটা বোঝে, যারা মাঠের বাইরে ফেন্সের বাইরে যারা বসে আছে তারা খেলাটাকে অনেক বেটার বুঝতে পারে, উপভোগ করতে পারে, এবং যদি ক্রিটিক্যাল হতে হয়, অ্যানালাইজ করতে হয়, সেটা অনেক বেটার হয়। সো সিমিলারলি ইন দিস কেস অলসো, the counselor is actually a person who's sitting at the fence, completely non-judgmental, এবং trained, completely trained, যে তোমাকে তোমার হাত ধরে ঠিক মতো তোমার প্রবলেমের হেল্প করবে। So this is a myth. So
just one more thing, what you said was such a good metaphor, for how counseling works, because the counselor is on the outside. Also, another saying that I like is that you give someone a fish, they'll eat for a day.
Okay.
And you teach someone how to fish and they can eat for the rest of their life. And counseling is also like that. You're not solving the problem for the other person. You're actually teaching them how to help themselves and learn how to solve their own problems.
The technique.
Yeah, the techniques.
Have you seen Three Idiots, the movie?
Three Idiots, অনেক বছর আগে দেখেছিলাম, but if you remind me, I think I'll
ওটাতে Amir Khan had a dialogue in that. He said that you have to say all is well, all is well, all is well. He says all is well, all is well. And then he said that someone asks that ये बोलने से क्या problem solve हो जाएगा? बोलो नहीं, all is well बोलने से problem solve नहीं हो जाएगा, but वो problem को सहन करने की क्षमता अपने में बढ़ जाएगी. So I think this is another metaphor which explains that you train the person how to deal with the situation in a completely non-judgmental way and increase your inner strength.
Exactly.
Increase your inner strength.
Life has so many stressful situations. Sometimes you can't control them. But what you can control is your ability to cope with those difficult, stressful situations. And that's how counseling helps.
Sure. In your vast experience of counseling, psychological counseling, could you just explain who are the people, what kind of problem if people are in benefit the most out of this clinical counseling?
So I think I would, I personally believe that almost everyone can improve their potential and reach their maximum potential by being part of a counseling process. But on the other hand, to answer your question about who will benefit the most, I think two categories of people. People who already have a mental health diagnosis or an illness like depression or anxiety, but also people who are going through a very stressful life situation. Yeah. That can be the loss of a loved one. It can be, anything that affects your identity. So I know the kind of work you do. I can see how someone who's coping with infertility, a couple, can really, shake their sense of self and make them question, why is this happening to me? So I think, how do I cope with this? How do I carry on my day-to-day life while I'm going through the difficult, stressful situation? I think that's how counseling can really help.
True. True, absolutely. And another stressful situation, I will say, like you said, that loss of a loved one. Loss does not always mean death. It does not always mean death. Right. It also means that if you lose a loved one from your life, Narikatha deals with, it concentrates on problems of women. So I think I would like to focus more on women problems and the importance of counseling in it. So in modern life, I've seen that the divorce rates are really, really increasing. And somewhere I have read this, maybe in a magazine, that divorce is one of the most stressful situations in one's life. So I think, what do you think that, in what percentage people who undergo divorce take the help of counseling?
I mean, I think I can really see how counseling would be very helpful for someone who's going through a divorce, because like you said, it's a huge loss, Not only do you usually lose a person, but you also lose a whole way of living sometimes, You might not have...
For a woman, it's also a loss of identity in our country. Because there is a name change after marriage. There are many women who change their surname. And then the name changes and all the records which have to be changed.
So Amike, a question that a lot of women might ask themselves after a divorce. And the other thing about divorce also is that, it can bring up a lot of feelings of self-doubt and a lot of feelings of like, did I do something? That can just make the situation worse and worse, and people can spiral into depression as well.
Yeah, so counselors help, I think. So what I gather from you is, the ideal situation would be that everyone should have counseling sessions to bring out the best in them. But there are some stressful situations in a person's life, more so in a woman's life, which has to be, strengthened by counseling.
I mean, I think, there are, you mentioned another thing about divorce is Amader culture. So I think culture is also a huge role. Na? Yeah. So, how much the culture is stigmatizing what the woman is going through. So if the culture really stigmatizes divorce, definitely the woman will go through a lot more stress, and counseling can help with that a lot. Like having someone to non-judgmentally hear you and give you, options and help you understand what you want, who you are at the end of this traumatic ordeal.
Very true. When your video did the rounds for the last 2 to 3 days, where I'm asking all my followers and patients and friends to join us on Facebook Live today. Many of them have WhatsApped me certain questions and mails also. I've taken them down here. There is another myth that, and I've heard this a lot, that when you choose a counselor, it's better to choose a counselor of the same sex. Because a woman is supposed to understand a woman's problem better, and a man is supposed to understand a man's problem better. That is one part. And there is another part, which I think we will come to it later.
Sure.
But do you agree with it? I mean, how much of it is true?
I don't think so. I think, the rapport between the client and the therapist, you need to feel a good connection with your therapist. But I don't think the sex or the gender of the therapist will make the therapy good or bad. Now, I think, there are some situations, maybe someone went through a really stressful situation with a man, and maybe they feel more comfortable talking to a woman. Tale, I can understand how, it's a personal preference, but I don't think, in terms of effectiveness of counseling, there's a real difference.
Okay. But when you open your heart out to a person, so a counselor is a person with whom you really share your secrets. And when you open a heart out and that person is trying to teach you life skill, is trying to teach you how to cope with it. So many a times, I've heard about it, and there was a movie also, Dear Zindagi, where the patient falls in love with the counselor.
Exactly.
So, is there a name for it?
Yes, I'm smiling because one of the reasons why I avoid TV shows or movies with counselors and watching things which have psychologists, always the psychologist and the patient are always going to get together in these movies. But in real life, that is completely unethical. And
movies have to be melodramatic.
Yeah. And counselors have taken an ethical vow to not have that kind of relationship with their clients. And there's a word for it. It's called transference. And you're right. You're in this room together. You're sharing your
deepest secrets. Yeah.
You're opening up to them. So there is a tendency to feel like maybe there's something here. But that's why it's called transference. So you're transferring romantic feelings onto your counselor. So
okay. But the counselor is supposed to stay inert and is bound by ethics.
Yes.
And
yeah.
And do you have something like a oath taking like we doctors do?
So when I was in the US, then you did. You had to, abide by the APA ethical standards of no harm, and one of the big standards is you don't have a dual relationship. Your client can't be a friend, your client can't be a lover or someone that you're romantically involved with, because that's considered an ethical violation. But in India, I think counseling is still a growing field. But I think most professional counselors that I know, they take a personal oath and to do no harm to their client and to improve their client's life.
Yeah.
And, emite, there's a difference. Like the counselor isn't talking about their life, but the patient or the client is talking about theirs. So, there's a power difference there. And that's why it's considered unethical for the counselor to take advantage of all the secrets that they know and of the client. So usually, there's no romantic relationships. And
yeah. So, but it happens.
The feeling is natural.
Yeah, it could be a one-sided. The two-way thing is forbidden, and you're bound by oath. But one-sided, especially if you're a young person and sharing your secrets and finding the counseling sessions very, very useful. Somewhere you develop a soft corner.
I mean, I've worked with people who have told me that, I think I'm getting some kind of feelings, but I think then it's up to me in that moment to explain to them that, this is natural.
Yes.
This happens, but this is not actual attraction or...
Yeah, I do understand. After all, we're all humans. Another thing, while you were talking, you said that, like I'm a doctor, so I'm also bound by the Hippocrates oath. And people who come to me, they have some kind of a disease. So they are patients. But people who come to you, you don't call them patients, you call them clients. The same thing is, when, we're talking, so better to discuss. So, when women come to us for abortion, they want a termination of pregnancy. They are not patients. Okay. So the patients who want termination of pregnancy voluntarily, we call them clients. Those who want a medical termination of pregnancy, then they are clients. They are not ill. They are not ill.
Exactly.
So they are clients to us. Patient who wants a ligation, she's a client.
Yeah, because there's a medical disorder or a disease that you're trying to cure or solve or manage in that moment.
Absolutely, absolutely.
And that's a good point because, again, like going back to how even in psychology, first clients were called patients, but then as the field evolved, it's become more broad and more people have seen the benefit of counseling.
True.
So you don't have to have a serious mental health issue to go to a counselor, and that's why we call them clients, because anyone can benefit from the service.
Yes. So, this is a very myth being busted that for them, for counseling, they are clients. They are not patients. So the whole concept, যে আমি কি পাগল নাকি যে আমাকে কাউন্সেলিং করতে যেতে হবে, না তুমি পাগল না, তোমার স্ট্রেস হয়েছে, and the counselors are trained to teach you how to manage this stress. So I think it's a big step forward, and whoever is listening to this will clearly understand what we mean by it. And as you were talking, you said that the difference of power, যে ও সব সিক্রেট গুলো আমাকে বলে দিচ্ছে, আমি তো আমার লাইফ নিয়ে ওকে কিছু বলছি না। তো এখানেও একটা there is this myth that counselors, they know all our secrets and they can or they will divulge these secrets to my family members when they visit the counselor to ask that what it is or how it is. So I think you have already answered that you're bound by oath not to divulge any of the client's details. I'm avoiding the word patient to avoid the client's details. So be very, very sure that the counselor is here to help you. She's not here to use the information, leak the data, or to blackmail or to do any kind of vicious activity. None at all. And we are bound by oath. So something very, very important here. Then
confidentiality is a huge part of what so when I take notes, I never write down any identifying information. I always keep everything under lock and key, and I never talk about my clients to anyone. That's very important to me and most professional counselors.
Excellent. So another is any other myth that you would like to discuss today?
Often, after a counseling session, people are like, okay, so tell me how to fix the problem.
Okay.
And I think that is also a misunderstanding of what the counseling process is. Like, the counselor can definitely tell you, okay, you have these symptoms of depression. So you can try exercise, you can try these different journaling techniques, you can try mindfulness meditation. এরকম করে the counselor can teach you different things, but what will work for you in your specific situation is very unique to you. So the counselor can't just give you one size fits all kind of answer. So the counselor again helps you find out your own answers. So what's important to you? How to meet your goals and your needs.
Yeah.
So it's
So
not
that is the
advice.
thing about living things,
Huh.
So we are not machines. Yeah, we may function like machines,
Mm-hmm.
but we are living machines.
Exactly.
And that is why we are all different. And the approach always has to be tailor made and completely individualistic.
Mhm.
So, what works for A never works for B. Overall, it may be same,
Mhm.
but it has to be individualized. That's what you mean, right?
Yeah. And the client is an active part of the. It's not like the counselor is doing something to the client, because the client has to learn these skills. And then, it's 1 hour in a week. But for the rest of the week, the client has to actually take those things
True.
and practice them with other people in their life. So, say the client wants to learn how to be more assertive or how to be more direct in asking for what they need. Now, that is a long process, because whatever habits we have, whatever is keeping us stuck in our lives or causing us stress, didn't suddenly happen. They evolved over a long period of time, usually. So they won't go away with one session, but a counselor in one session can significantly show you the hopeful path ahead. So I think that's also an important thing.
It's very, very important. It's hope which keeps all of us alive.
That is the most
And one should never lose hope. Never lose hope is the moral of the story.
Like, one of the biggest signs of depression and, I think knowing that someone is maybe thinking of suicide is that they feel hopeless. That is a big risk factor, and it's a trigger in many ways for many people.
True.
So once that hope goes, it's hard to get it back, and a counselor can help you do that.
Yeah. You're reminding me of that Pandora's box story.
Yeah.
There were so many insects which came out of the box and it bit everyone, and that was disease and pain and suffering.
Pestilence.
But then came out a little bright fairy, and with her wings, she just touched people, and she was the hope fairy. And in spite of all these sufferings, it is hope which keeps us alive. It is hopes which makes us move forward. So, counseling is definitely giving hope to people who are losing hope or have lost hope. So that is something, and it makes you able, it increases your tolerance limits, and it helps you to cope with stressful situations. Now, since URVARAA IVF is infertility clinic, it's a fertility clinic. Now, infertility clinic is a very negative word. In means actually no. So gradually, we are moving from negativity to positivity. So we call ourselves a fertility clinic, where we help people to become fertile. So here, what I have done is, I have understood this importance of counseling in my patients, because these are the patients who come to me with very fat packets of doctors' prescriptions and lot of tests and medications, and lot of them completely lose hope. So here, with science and technology, we try to give them hope. And it is the psychological counselor, who binds this together. And definitely the clinician is, but we always, try to reinforce it with a session of psychological counseling.
Definitely.
So in my IVF package, I have included minimum 2 sessions of psychological counseling, and you're doing a great job. And, one is before you embark on the IVF treatment, and the other one we offer after the result. So whether it is a positive result, then also you need a counseling as to how to go about it in a positive manner. And if the results are negative, which happens all the time, then it is called a negative counseling, where the patient and her husband and the family is asked not to lose hope and to try to focus on why it did not work. Many times we don't have an answer, but then we always try to give them some kind of a alternate solution to how to become pregnant. Now in this journey, we have seen that it is the woman. See, there are three things required for a good pregnancy. A very good egg, which comes from the woman. A very good sperm, which comes from the male partner, man. And the womb, the uterus, where the baby is supposed to be carried for 9 months. So that is again comes from woman. So, the woman contributes 2 things out of 3.
Yeah.
Okay.
So there is a disproportional burden.
There is a great disproportion of the entire burden. Most of it is with the woman. And the minute, it does not happen, there is so much feeling of inadequacy. Today, my heart goes out to one of my patients who gave me a call this morning. It is a very, very sad story, but it's true. And truth is any day stranger than fiction. Today I got a call from my patient who told me that she's only 22 years old and she had an IVF cycle, and because both her tubes are blocked and which failed, and it seems I have told her that IVF is the only option by which she can get pregnant, because I have also done laparoscopy on her, and she has endometriosis, and it seems I could not even see the tubes. So, leave alone try to open them. So, now this patient's husband, she told me, she said that my husband has given me 2 options, either to give me a divorce or to give me a permission to marry again. So she's telling me that Didi, Ami second marriage option ta ami dite parini. So I have chosen the divorce option. And he has taken away all the papers because he wants to show to his next wife that all the problem lied with her and he does not have any problem. And I'm telling you, I was speechless after the phone call. I was so affected that, as it is, she's feeling so inadequate, sad, stressed out, and on top of that, this is happening. So it is our society, it is reality, we are facing it. And so all I could tell her is, you must come and meet me once. And I have to see what I have to offer to her, So but this is how
that,
it is.
That even that you heard her out, you called her in, and it sounds like you were the one person in her life who wasn't judgmental, who wasn't telling her it was all her fault. That's a huge gift to give to someone.
Yeah. So she's going to come this Saturday. Again, I came back to the clinic, I took out her file and I've called her again. And she has said that she's going to meet me this Saturday. So, this is reality. Okay. And my heart really goes out to couples like this, who yearn for a child and how they cry. And they really benefit with counseling. So once they are out of my room with so much of positive hope infused into them, then they go and visit the counselor. And after that 1 hour session, they really come out, well, and they are ready to accept reality. But few people will not change. Few people will need, even I want to be hopeful. I do not want to say I'm taking back will not change. I would rather say they will take time to change.
That's a good.
And it is and it always has to be our endeavor to try and help these people.
Yeah, and I think one more thing in terms of how, going back to what we were saying, like terrible situations like this patient you're talking about, it's very poignant and sad, and it makes you feel like you wish there was more you could do.
True.
And sometimes in life we can't change the circumstances, like
Yes,
you were
true.
saying, but we can change our ability to cope with those circumstances.
Yeah, same here. I was
So,
thinking I will tell her that you're only 22, you're a graduate,
mhm.
you try to find a job, try to get some more education,
Yes.
and then we'll see what to do.
Exactly.
I have some frozen embryos,
Mhm.
so I will talk about them and let me see what I can do. So,
Yeah.
it's this compassion
Exactly.
and the fellow feeling of humanity.
Empathy,
Absolutely,
empathy. Just
empathy.
putting yourself in the other person's shoes, like what they must be feeling, ki bhabche, ki hocche ওদের জন্য, that
Should be
is
there.
really.
Like you said, you had an oath that your clients will not be your friends.
Mhm.
Okay. So if you look at my Facebook profile, you will see that I'm friends with so many of my patients. And the doctor-patient relationship, you'll agree that even when you're counseling, as you get to know them over a period of time, and there is a relationship.
Of course.
There is a relationship. It may be professional,
Yes.
but a relationship forms.
And I would go even further to say that relationship is part of what is healing.
Yes.
So what
of
you were
course.
saying about it's not just the treatment you offer, but the way you are with people.
True. And when you talk to a person, so even that conversation, I was marking how she's talking, how she's saying, and trying to feel her pain. And I'm sure similarly she was marking the way I was talking, and she was trying to feel the comfort that I was trying to offer, over the phone.
Yeah.
So, and she said she will come on Saturday. So this is what how it is.
And I think it's slightly different, when you're dealing with psychological issues and when you're dealing with
Physical issues.
issues. Because the reason why I don't want to be friends with my clients is because then I might lose some of that objectivity.
True.
Which is not that much a requirement for the kind of work that you do. But I think in order to be an objective counselor, that's why I prefer. I mean, of course, I want a good, friendly relationship with all my clients.
How many how many sessions do you think is required? I mean, on an average, I know it's individualistic, and but on an average, what is your observation?
On an average, I think there's some research which says that as little as 3 to 8 sessions can be beneficial for brief issues. But again, there's so much variability. So
and how they should be spaced?
I think ideally you should be seeing your counselor at least once a week.
Once a week.
Okay. I mean, for some people who are in less stressful situations, maybe it's a more ongoing issue. Sometimes people see their counselors once every 2 weeks, but if it's something you really want to work on and improve, then seeing them once a week is.
And like we call our patients. So here, do you call them, or is it driven by the patient's need to see you? I mean, how does it work?
So I usually talk to my clients in their first session that what I think is a good treatment option for them. So based on my intake assessment of my clients, I tell them that I think weekly sessions will be beneficial for you, but I never push them.
Yes.
So I think because
that's important.
Yeah.
That's something very important, she said.
Because counseling, the person, the client has to really be involved in the process. And if they are not ready for change, then I don't think it'll be that helpful.
So the thing is, we advise.
Yes.
We do not force.
Yes. Exactly.
It is not an order. It's not a force. We are not pushing. What we say is we advise.
And I think, then the client can also feel like, no, I'm invested in my own mental health. So I want to do something. So I will call my counselor and set up an appointment. So I don't think it's helpful to force people to go to counseling. I mean, I think there are some situations, if someone is suicidal, then they need immediate crisis intervention. But outside those risk to themselves or others, I think the client should, make the first step in terms of, I would recommend one session to give them my opinion and my advice. But after that, it's up to them to take it or not take it.
I get you. So please send us your questions and we will come back again, because this is just the beginning and it is a vast subject. And please send us your questions. And if you do not want to write on the wall, then please message me privately and we will take up all your questions. And please don't worry, the identity is going to be a secret. So I'm not going to take names. And we will still try to solve your issues. Maybe we will call you personally if you send us your number, or we will try to message you, or we will have another session of Facebook Live where we will take up your topic and we will inform you so that you can join us. Thank you very much.
Thank you.